And welcome back. I'm Mabel Jong. You're watching coverage of the World Healthcare Congress 2018. In my studio right now, we have Don Reiman, who is president and founder of Echelon Group Incorporated, based in Idaho. Thank you so much, Don, for your time today.
It's a pleasure to be here, Mabel.
Well, the Echelon Group offers a range of services, from financial planning to benefits consulting. Tell me if what you're finding in your area. Are you finding more challenges, or are you encouraged by the number of things that we know about your sector now?
Well, in the benefits area, I think everybody in the industry is challenged because of the uncontrolled costs that are happening. Mm-hmm. And there's a myth out there that healthcare costs are going up dramatically. And if you dig into it, it's really not the care of costs, but the people that are providing different solutions kind of have their hand in the bucket, so to speak, taking money out where it shouldn't come out.
Okay, yes, because you use the word myth, so you don't believe that's the case, that healthcare costs are skyrocketing. You do believe that in some areas this can be controlled.
Correct. We actually have employer groups where we've been able to go in, design a plan where the employees can go to a hospital that we've contracted with and have a baby for $400. They can get a knee replacement for $400. They can go to a primary care doctor for $10 and have everything that's done there covered. And providing that kind of a benefit, the overall health care cost spend for the employer is lower than it was on the traditional plan.
Well, it sounds like it. How are they finding these kinds of prices?
Well, it's a matter of only paying reasonable cost and finding hospitals that are willing to deliver their services at a reasonable cost instead of marking them up 400 or 500% to then give a 30% discount to a PPO contract.
Okay, so how does this benefit hospital organizations to really offer these kinds of prices?
Well, the hospitals that are participating, because of the benefit design, our employees are choosing to go to those hospitals instead of to the hospitals that are overcharging. So one of the things that a lot of people don't realize out there is healthcare has almost become wealth care in a lot of ways, that a lot of people, it's really about delivering healthcare has become all about market share and revenue. So if we find a hospital that's willing to contract, accept a reasonable cost, by designing that benefit that the employee goes there and can have a baby for $400, they will utilize that. And because the hospital then saves, because they're not trying to collect large deductibles and out-of-pockets that the employee can't pay, so they don't have the collection side and the delay in getting payment and have to write off a lot of a bill.
If the equation is so simple, why aren't we seeing more of a universal approach to this in this area?
I wouldn't say it's simple. It's a lot of work to find hospitals and explain it to them, and change for anybody in any aspect is hard, and the industry is so steeped in the way they've always done it. Hospitals are afraid of what they call cannibalizing themselves. If we take a lower cost on a service that we're maybe marking up 300% and you only want us to mark it up 50%, that they're going to lose money. But it actually doesn't work out that way if you bring additional members to their facility. Okay.
Do you think that these cost savings are unique to your area of business, to Idaho perhaps?
No, not at all. In fact, we're hoping to expand our programs into other areas of the country. It's really about finding areas where you have willing partners, including primary care physicians and specialty clinics. And our program is reaching a level now that we actually have many of the independent physician groups in our area contacting us to see if they can contract with us and be part of the program.
Who is the ideal Echelon Group client?
The ideal client would be somebody that's 100 employees or more that is willing to change and put some energy and effort into, because there is more work involved. There's educating the employees and taking a little bit of risk on not having been in this kind of program. And if they're willing to do that, we're able to take and instead of having a 6 to 12% annual increase in their health care spend, flatten that out to a 0 to 3. And in most cases, we can drop the starting point by 20 to 40% because of the savings.
And how long has Echelon Group been around?
Well, Echelon Group's been around since 2000. Mm-hmm. We rebranded at that point, but we actually started the agency in 1992.
Okay, so since then, have you found your work to have gotten simpler or more difficult in this environment?
We actually went through a curve. The work got harder because we had less solutions. With the commoditization of healthcare, the Affordable Care Act, it took a lot of the flexibility that brokers had away in doing plan design and things like that. And then with all the PBMs, prescription benefit management companies, having all the kickbacks they do along the way, it got harder and harder to control costs. With the solutions that we're bringing, and actually I'm more excited about our industry than I've ever been in my career, because we actually are finding solutions to be able to provide affordable care. And one of the things that we ask that's different is, when does insurance stop being insurance? And when you look at out-of-pockets and deductibles and what employees are paying for their premium, and it's 25 to 35% of their family household income, that's not sustainable. So providing a solution to that and getting it where they can, afford to go get health care that they should get, that's made it exciting again and interesting, because we really feel like Echelon Group is changing health care.
All right. Don, let me ask you, we're so pleased to see you here at the Congress this year. What are you learning so far, and why did you come?
Well, the World Health Congress is actually, from our perspective, a coalition of a minority of people in the country that are committed to making the changes to provide a better delivery and better outcome for employees across the country. So the vendors that are here that are doing unique things, other brokers and consultants that are here that are like-minded, down to even some of the providers and hospitals and physicians that are attending. So it's a place to come where other people are on the cutting edge of what's happening, instead of just following the old, the way it is approach.
All right, Don Reiman, thank you so much for your time today. We
Thank you,
appreciate
Mabel.
it. And I'm Mabel Jong. Thank you for watching. Stay tuned.